Hi everybody, this is a bit of a take two. The other video didn't work properly because I forgot to put the audio input onto scene 2, which is when you're looking at the presentation. So sorry about that. This is an update on the digital maturity work we're doing across Wales, just so everyone's aware what's going on, and it's got an ask on it in terms of what I need you to do to help to make this a success. First of all, the HIMSS assessment on-site visit happened at BCU yesterday. That was Friday the 10th of February. John Rayner and his colleague came. We'd organised an agenda for the visit, which was a tour around visiting certain parts as required. So Aaron Crew and James Sattel pulled that together and organised for particular clinicians or particular users in particular areas to have those conversations and show John and colleague what's what. Feedback from the HIMSS colleagues is that the way the day was organised in BCU was excellent, and that helped them to easily make an assessment and get a viewpoint on where we're at. With regards to the results of that, that's something to discuss at digital directors. There's a good spread of good practice. There are one or two things which potentially hold us getting further up the ladder, but these are good things which we can discuss and clearly identify and talk about in digital directors or hopefully in other forums which involve clinicians as well. Obviously, the HIMSS assessment is the functionality assessment. What can you do? What can EPRs do, etc. Whereas the KLAS assessment is a usability assessment, which is a different assessment altogether. That involves an electronic questionnaire which will go to all clinicians. It's designed to keep integrity with the survey and the method. It's designed for the folk in KLAS who've tested it hundreds of thousands of times across the world, so we need to maintain the integrity of that survey. But in terms of getting the best of it or applying that survey in the context of Wales, it's also important to understand how that's going to work, and we incorporate aspects which include the Welsh context in terms of the systems we use and all that type of thing, because we haven't got one EPR, of course, in Wales. There's some workshops to get that designed and sorted out, and my ask is to get your clinicians involved in that, please, and make an effort to make sure that they turn up. There's 3 workshops, repeat workshops, one on 22nd of February, 3 till 4 in the afternoon, one on the 1st of March, 3 till 4, and one on the 3rd of March, 3 till 4. And the reason that they're all in is to make sure we get as much of a spread as possible, because making the KLAS survey effective is reliant on how good the engagement is with your clinicians, and in particular we want your clinicians enrolled in what that model is and how it's working, so we don't get any kickback later on. Just flicking over to the presentation, this will be attached. All the presentation shows is basically what the survey is, why, who, when, how, etc. You can obviously read that at your leisure. You know that all of this anyway, but feel free to use this as you need. It's got the timeline there from project initiation out to the results analysis and what have you. It's got the project team names there. Louise Gregory from DHCW is the project manager. So Lou Gregory, as she likes to be known. So connect with her if you need anything, but you'll see the key contacts in here. Harriet Stone and Nadine. Harriet in particular is looking at how we can apply the results of this to potentially design some work into the future, more incremental work in terms of making some big improvements based on the current capabilities we've got. Remember, the KLAS survey is not about functionality, it's about usability, and there's lots of things that can impact on that. Poor network, poor training, a whole mix of different things. It's not just the usability of the applications itself. So we've got the guys looking into that, and there's been lots of communication and feedback as a result of this approach. The clinical leads that I talked about, here's the list of all of those. They're in the slide deck. Again, just the ask, please get them to be engaged. It's really key that you use the clinicians to engage with other clinicians in your organisation to get them to fill this questionnaire in and be the front and the face of that in your organisation. This is asking the clinicians what they think of the systems, which is not something that often happens, I would guess. So here's the list. It's in the slide deck. You've had the dates: 22nd of Feb, 1st of March, 3rd of March. All of those days, it's 3 till 4 in the afternoon. Please get your guys to be involved in that. They should have invites in their diaries to choose from. Moving back to my ugly mutt. That's the end of the presentation, really. If there's any more questions or anything from yourselves, please give me a shout. And apologies, I've had to redo this video because there was no sound on part of the other one. So catch up with you all soon. Thank you.